Also, we're very lucky today here in the District of Columbia because the Capitol was not harmed as was possibly expected. And then we're even more lucky because we're going to hear from Dr. Lane Wagaman about hypnosis, a special evening of hypnosis. And I'll tell you a little bit about him. He holds a number of positions of teaching and consulting in the American Society, the Society of Clinical Hypnosis, the American Psychological Association, and the Society of Clinical and Experimental Hypnosis. He's been involved in numerous psychological programs. In fact, I wrote to him this morning, and I'm glad he has a sense of humor. I said, I think I'll just tell the audience that you've been involved in a thing or two. And he wrote back, but only a thing or two. And so I was pleased to hear that he jokes, and I think that will make it even a more glorious evening. He has been also in an active member of the American Academy of Pain Medicine. He's been the continuing education committee of the West Virginia Psychological Association, and on. But I'm really eager to hear you, Dr. Wagaman, and I think everybody else is too. And so I'll be quiet. And welcome to the West End Foggy Bottom Village.
I thank you for that gracious introduction and for your kind invitation to join you this evening. I'm hoping we can impart some information and have some fun at the same time. And let me start off by saying that my co-presenter is unable to be here this evening. There was a family emergency this afternoon, and she had to drop out. So I'm sorry to tell you, you're stuck with me for a while, but we'll get through it. And then you can reward yourself however you reward yourself after you've gotten through this evening. So if you'd like to unmute yourself, I know Jonah just asked you to mute yourself, but let me just ask quickly, what do you all know about hypnosis? What have you heard about it? Or what are you interested in learning about it this evening? Anne, yes.
I know nothing about it. I mean, I know about hypnosis just from movies and television, but I don't know how it's used clinically, and I'm just very curious.
Okay. Well, you can forget the first part, the movies and television, because that's not the way it works. And we will talk about how it's used clinically in medicine and in mental health and in dentistry, actually, as well. So, good.
I'd be curious to know the context, what issues hypnosis is effective for, and whether everybody would be a good subject, or are there issues or conditions in which hypnosis is not effective?
Good. We actually have a section where we'll talk about exactly those questions, but so that should cover that. Anyone else?
I know a little bit about hypnosis. Somebody did, a practitioner, a legitimate medical hypnosis practitioner, did attempt to hypnotize me. I don't think it was entirely successful. The desired outcome was not reached, but I'm interested in learning more and seeing what might be possible.
All right, we'll cover that. So I'm going to, I've got some slides that might help us here, and let me go ahead and share this screen with you all. There we go. Okay. Let's begin, if it's okay, by going back a little bit to the beginning of time, actually. And we have every reason to believe, as we view hypnosis today, that that trance or hypnosis has existed really from the beginning of mankind, which takes us back millennia after millennia after millennia. And we have, well, let's just talk about that. It goes back millennia after millennia, and we have some evidence that goes back thousands of years. We have cave drawings, we have papyrus sheets from India, we have writings that go back 2,000 or 3,000 years and talk about and describe hypnotic process and hypnotic experiences and trance. So hypnosis is really both an ancient practice that continues to evolve. And the interesting thing about that evolution is that even though I think we're a whole lot closer now than we ever were, but the interesting thing is that until recently, there's never been consensus among hypnosis practitioners about how it really works. With new brain imaging strategies and equipment over the last 5 or 10 years, we're understanding a whole lot more things than we ever thought possible, including what happens to the brain in hypnosis and what happens to the brain in the hypnotic process. And real quickly, I can tell you that a lot of these were a surprise. When I was an intern a long time ago, we were taught that hypnosis was really a process that occurred on the right side of the brain. And the left side of the brain really didn't have much to do with it and was pretty much out of it. We know now that not only is that not true, but the right and left sides of the brain really are in many ways equivalent and can trade off and cover each other and take care of things and take care of processes and responses if the other side is injured or incapacitated for some reason. We also know that the brain really functions on a matrix of points that interconnect with each other and interconnect with the rest of the body. And in hypnotic trance, when people are in hypnosis or in trance, those matrix points begin to change position and change which ones are predominant and which ones are not. And over time, people who practice self-hypnosis actually create physical and physiologic structural changes in the brain. So it's not at all what we used to think it was. But if we go back a few thousand years, we know that hypnosis really inspired a lot of speculation, a lot of belief and disbelief, a lot of fear, and a lot of scorn, really. And all that time, it's really been, as I said, we really never have understood exactly how it works, but we understand how to create trance and make it work. If you think about what you've seen in movies and TV, where somebody is in control of another person because of a hypnotic trance, or waves a watch in front of somebody and puts them into trance, and then they go out and rob a bank, and when they come back, they drop the money off in this guy's car, and they go back home, and when they close the door at home, they have forgotten everything that happened and everything they did. Well, none of that is true, and none of that is the way hypnosis works. So we can assume that all that really had to do with people's beliefs about mysticism and magic and what controls us. There's been a cyclical pattern in the understanding of hypnosis and the use of hypnosis. And we still see it in young professionals whom we train, and not so young ones that we train in hypnosis. People start off being just curious about what hypnosis is. What is it? How does it work? What can I use it for? Are there things or people that it's especially good for or not good for? So they're just curious about it. And that curiosity evolves into more interest, and that interest evolves into an acceptance of, I'm not sure I really fully understand this, but I do understand now that it works. And that evolves into enthusiasm and real dedication to the use of hypnosis clinically in clinical practices. And then over time, and we saw this happen with a fellow named Freud and a friend of his named Charcot, who were very, very interested in and enthusiastic about the use of hypnosis, particularly with women and hysteria. But then when they stopped getting the same results, they lost their enthusiasm for it and started being critical of it and really abandoned it for other things. And for people like that, then the use of hypnosis just lays in disregard. And then there's a latency period, and then people get curious again about it. And I wonder if I gave up too soon. I wonder if anything is new in the world of hypnosis. Hypnosis is also very much like medicine or other healing arts, behavioral health or mental health, and religion. Would you agree that there are rituals in religious practice? Would you agree that there are beliefs that are involved in medical practice? We believe in our primary care providers. We believe in medications that we've taken before. Expectancy plays a big role. We take medications, we see primary care providers or specialists with the expectancy that they will help us and we can get through what it is why we're there to see them. Religion and medicine involve altered states of awareness and consciousness, sometimes medication induced, sometimes induced by the brain itself. And they all involve dissociation. Dissociation, there are two ways to look at dissociation. One is the way clinicians look at it as a pathological state. And the other way to look at dissociation is a more positive way. And it's that sense or that feeling that you've kind of moved away from yourself. And maybe your arm feels funny and feels as if it's not even yours for a while. If you've had surgery and you've had anesthesia and you're coming out of anesthesia, that's a dissociative state when you're going into and coming out of. It's just as if things are not real around you. We talked about finding Egyptian stones and papyrus, 3,000 or 4,000 years old, that describe and depict hypnosis and trance states and what people do in trance states. Lots of the writing of the Greek oracles are pertinent. There were Greek sleep temples, there were Indian sleep temples, Indian yogi and the Persian magi, and European religious leaders were all people who used early forms of hypnosis that led to trance. In our country, in North America, It was the early medicine men and the shaman of the native peoples here who used lots of rituals, chants, drumming, blowing of smoke into the eyes, staring into fires, all those things that create hypnotic experience and create trance. And there's been another cycle that I think is just important to mention. Franz Bauman, who was a pediatrician in San Francisco, I believe he's still alive, but not practicing. Bauman wrote a lot about hypnosis early in his professional career. And he said that the earliest practitioners of trance were the first mothers comforting the first children with their first boo-boo. And those of you who have had small children or been around small children who have fallen in skin in the ear, bumped a head, or have seen the almost miraculous change as soon as they're in their mother's arms. They become calm, quiet, more comfortable, and it takes almost no time at all for mothers to do that. And that's the creation of hypnotic trance. So it goes back long, long way. Really, the first writings began with religious leaders, and medicine and surgery followed. Then some other pure sciences, and then behavioral health. Really, mental health got really involved after the First World War, when we had a lot of soldiers coming back with what was then called shell shock, is now called PTSD or PTS. And we've cycled through these rotations where it goes in and out of favor, or in and out of interest with different professions and different leaders. So let's look at what I like to start with talking about what hypnosis is not, because I think it more directly addresses what most people have heard about hypnosis. So, hypnosis is not caused by the power of the clinician using the hypnosis. And hypnosis does not allow someone else to control your mind. Your mind is your mind. It's under your control at all times, and no one else can control it. Only certain kinds of people can be hypnotized. That might be only the very bright people, or only the not so very bright people, or only people who firmly believe in it, or only the people who doubt it and see it as a challenge. Or only weak-minded people can be hypnotized. Again, not true. This is a popular one. Once you've been hypnotized, you can no longer resist it. So we can come back to you 6 years later, and with our watch or some word that we've given you to remember, and recreate that same hypnotic trance. Not true. Being hypnotized can be hazardous to your health. I used to say that this is absolutely untrue, but I've come to realize that there are a couple of exceptions. I would not recommend that my patients who use self-hypnosis do it while they're driving. That could be hazardous to your health. And we've had actually people leave a clinician's office not fully out of trance, and have trouble driving or have trouble walking because they still can't feel their legs. So it can be if we don't know what we're doing with it. Hypnosis is really an unconscious state or a sleep state. Neither of those is true. You're always aware of what's going on around you. It is not a sleep state. EEGs are not sleep EEGs. MRIs are not sleep MRIs. So hypnosis is very different from sleep. Does anybody, and we all go through this, but sometimes we forget that we go through it. There are times in the morning when we're in that place just between waking up and still being asleep. And there are times at night when we're just in that short period of between being asleep and being awake. They're called hypnagogic and hypnopompic states. Those are hypnotic states. So really, when we go to sleep at night and when we wake up in the morning, we're experiencing a brief hypnotic trance. And as you know, you always come out of those. Often forget them, often aren't even aware of them because they're so fleeting. How about one can get stuck in hypnosis? Not true. You're always in control of your own hypnotic trance, and it's not possible to get stuck in that trance. In trance, you will always know what's happening around you. You will always know what you're doing. You will remember. You have the ability to remember everything that happens while you're in hypnotic trance. Some things we choose to forget, but we have the ability to remember them. And hypnosis is no more than just being relaxed. I want to come back to that one later and give you a really good example. Hypnosis is an easy cure-all. Hypnosis doesn't work for everyone. It works for most people because it's a common occurrence that we go through every day, but it does not work for everyone in a healing sense. How about if I hear, sometimes people will come out of trance when we're working with them and they'll say, I don't think that worked. I don't think I was really in trance because I heard your voice. I heard everything you said. And we point out to them that that's exactly right. In trance, you do hear everything that is said. And then we ask them, and you heard the phone ring, is that right? Well, no. And you heard the siren outside the door, outside the office? Well, no. Well, actually you did, but your mind chose to ignore it because that was something you did not need to pay attention to. And hypnosis can be used to accurately recall anything that's happened to us. Not true. Not true. It can be used sometimes to help recall things. You all might remember the Oklahoma City bombing of the government building in Oklahoma City. And I can't remember how long ago that was, but probably 15 years or so ago, maybe 20. The law enforcement who were investigating that bombing really ran out of clues and ran out of usable information from victims. And they called in somebody that they had used in the past as a consultant who uses clinical hypnosis. And he was able to talk to some of the victims and some of the bystanders in trance, in hypnosis. And that's how they came up with the description of the yellow Ryder truck and the car that were involved, which is actually how they solved that and found the fellow responsible. Anybody have any other things that they've heard about hypnosis that they've wondered about it, whether they were true or not? No? Okay. I think it's safe to say that most of the things that you've heard from lay persons who are not trained in hypnosis have very little veracity. So let's look at what it is. We've talked about what it's not. Let's talk about what hypnosis is. Some people have described it as just using your mind. Barrett at Rutgers talked about it being guided daydreaming. Anybody here daydream?
Yep.
Anybody here get so involved in a book or a movie or a television show that all of a sudden something gets your attention and you realize, I, I can't believe this is 2 hours. It feels now like it's been 5 minutes. Ever had that experience where time gets distorted?
Yeah.
That's hypnotic trance. Some people define it as using your mind to help yourself or thinking to help yourself. The Hilgards talked about it being a controlled dissociative state. So a controlled state where you feel as if you're apart from your surroundings. You're somewhere else. A state of intensified attention, an interpersonal relationship, learning what you didn't know that you knew, which I really like because hypnosis is a natural state that we already have. We just don't know it and haven't recognized it. And hypnosis allows us to control what we didn't know we could control. We use hypnosis in medicine all the time to help people control blood pressure, to help them control blood sugar levels, to help them control bleeding. With hypnosis, we can help patients start and stop bleeding or change bleeding to the other side so that we can work on this side. It's a handy tool to have. I'm not going to read through these, but back in 1993 and then in 1995, the American Psychological Association decided that they needed a definition for hypnosis because more and more people were practicing it. And this paragraph was the definition that they came up with in 1993. It's short, it's to the point, but it certainly does not describe everything that hypnosis is. So in 2003, 10 years later, they decided, we really need to do this definition of hypnosis. And I'm sure most, if not all of you, have worked on or served on, volunteered on committees at some point in your life. Yes? No? Well, the same thing happened with this APA committee. They took that one paragraph and turned it into 5 or 6 that are very, very detailed and very tedious to read through and don't really tell us much that we didn't already know. And then in 2014, they revised the definition again, and it became even longer, which is not real helpful. So we're going to go back to the definitions that are helpful. You may see that longer definition in writing, but it's really only useful to really to researchers, not so much to clinicians. So Lawrence Sugarman is a pediatrician up in Rochester, New York, and he describes hypnosis or hypnotic trance as something that utilizes our inborn mind-body capacities. I mean, after all, what is it that controls everything that happens in our body? It's our mind. It's the brain and the way the brain functions through neural networks and the way the physiology constructs itself and reconstructs itself. And they said that hypnosis or trance is really just learning how to use the capacity that we already have in our brain and in our body to control what happens in our body. They also, in a later definition, talked about communication skills being important, which means that the clinicians, whether they're medical or mental health or clergy who use hypnosis, can only use it effectively if they're good communicators, if they have clear and accurate and understanding and compassionate communication skills that helps them relate with their patient and helps their patient trust them and to believe that they know what they're doing. Dan Arouse, who was a psychologist, said, hypnosis really is several things. It's a special state of mental functioning, and it's a technique that is used to create that state of mental functioning. And it's the experience of oneself while we're in that state. And the way that we experience ourselves when we're in a hypnotic trance is very different than the way we experience ourselves when we're not in trance. And I think the best answer of all is it's a hypnotic trance state is all of these at the same time. It's a special state of cognitive function. It's the method or the strategy or the technique that we use to create that state. It's the experience that we have while we're in that state, which is very different than an awake experience. And it's all of those. Friends of mine, colleagues of mine, Rick Voigt, Model and Delaney, in their very nice little book about the principles of hypnosis, talk about hypnosis being an inexact blend of science and art. And I think that's really true. The people who use hypnosis the most effectively are the people who can be creative and who can be accepting of their patient wherever they are, and not expect them to be what they expect them to be, but expect their patient to be what the patient says they are. And then they use that to create hypnotic trance. Hypnosis is a skill and a tool that is used to facilitate or to elicit or to bring out or create a state of trance in people. In that state of trance, when we hook people up to EEGs, again, it's not a sleep state, but it is a changed awake state. It's an awake state that allows us to not feel sensations if we choose not to feel them, for example, and we'll talk about that. So who of you have ever been in a trance? Mars has. No one else ever been in a trance? No? Those of you who said you daydream, daydreaming is trance. Those of you who get engrossed in a movie or a TV show or a book, and the next thing you know, somebody's saying, you haven't heard a word I've said for the last 20 minutes. Where were you? That's trance. And we go in and out of trance all the time. Most of the time for seconds, sometimes for minutes, sometimes longer. How many of you have been driving on an interstate highway and all of a sudden you realize, oh, this is my exit. And then you realize that you don't remember the last 6 exits or the last 10 miles that you drove. But somehow your mind was keeping track of things like it always does. And when it saw and recognized the exit, it kind of tapped us on the shoulder and said, okay, you need to pay attention now. You need to come out of that trance that you're in. And because we're getting off the interstate here. It's a naturally occurring state. And trance occurs, we go through trance, go into and out of trances all day long. Most of them for seconds, many for minutes, some longer. And what hypnosis does is show us ways that work for us to use that trance state in a way that would be helpful for us, whether it's to relieve pain or to prepare for surgery, or whether to go through surgery with no anesthesia except for hypnosis. Whatever it is, hypnosis is a way that allows us to learn how to enter and use that trance. So let me just say, trance and hypnotic trance are these four things. They're focused attention. How many of you can you, Dr. Chalik, you able to focus your attention on things and concentrate on things? Um,
Sometimes.
okay, but it's something you can do, right? When you,
Yeah.
So the first thing that hypnotic trance is, you already know how to do. And focused attention and concentration leads to inner absorption. We kind of just forget about things out here around us, or we don't pay as much attention to them because we're processing, or we're thinking, or we're going through some emotional kind of thing. And that really allows us to be more inner absorbed and more personally absorbed with what's going on. So focused attention, inner absorption. Can you do do you become inner absorbed sometimes and kind of wrapped up in what you're thinking about?
That happens during meditation.
It happens during meditation. Exactly right. Exactly right. So the first two things that hypnotic trance is, you already know how to do because you do them every day. Hypnotic trance distorts time. It might constrict time, or it might expand time. So some things will feel as if they're much longer than they were, and some things will feel much shorter. That's helpful when we're preparing patients for surgery, because in trance, they can experience the whole surgical procedure as a matter of minutes or seconds, when in fact it may have taken hours. Or they can experience how well they're feeling now and expand that to hours and hours and hours before the chronic pain returns. And these three things, focused attention, inner absorption, distortion, and feeling as if things you're apart from things around you, lead to openness and to change, and to be and to accept suggestions that your clinician might be offering you. So this is a definition, a working definition of hypnotic trance. And we know now that all of us are able to do this. In fact, all of us do these things every day. So we experience trance every day, multiple times every day. It's a natural way that human beings function. It's the way our brain functions. So clinical hypnosis then is a strategy, a technique, a way to help people learn how to harness these and use them intentionally, and not just naturally and accidentally, but use them intentionally to create or to reach whatever goal it is that they have, whether it's performance enhancement or performance improvement, or whether it's studying better, or whether it's not experiencing chronic pain as much or even at all. So how does this work? Short answer is we don't really know. We're getting closer to understanding now that we can see the brain, the matrix in the brain working and changing the physiology and the structure of the brain. But we don't really know yet. We just know that it's something that all humans are capable of and have. We do know that some things make it easier for this trance to occur. We know that there's no right or wrong way to experience trance or to create trance. Everybody's trance is his or hers, and our trance states differ from time to time. Sometimes it's hard to concentrate and to focus. Other times it's really easy to get lost in that and to become very inner absorbed.
Dr. Wagaman, I don't know if this is a good time to ask,
Sure.
but I find when I do meditation, I tend to be more responsive when it's a voice of a certain quality. So you were talking earlier about good communication skills. For me, it's not just what is being said, but the tonality involved, the texture of the voice. Is that an issue with hypnosis and trance?
It's a huge issue. How we communicate is a huge issue. And when people come, when people are in their first training experience with hypnosis, we spend a lot of time talking about your hypnotic voice, which is different than your everyday voice. The hypnotic voice is calm and it's comfortable. And even though it's calm and comfortable, and sometimes gets into a rhythm and a pattern, and sometimes that rhythm and pattern allows the person who's in the office with us or in the exam room to become even more calm and comfortable, even more confident that things will be all right. And the people who use this best are flexible and adaptable. And they don't depend on a written script that they read. They depend on the conversation they're having with their patient and what the patient tells us. And then we take that and use it. Is that what you had in mind?
A little bit more than that. So if someone had a very sharp tone, I don't know how to describe it. I guess the adjective I might use is mellifluous. A very a softness,
Yeah.
you know, or and sometimes related to pitch.
A gentleness.
Yeah.
A quiet, gentle tone that's not rushed, that takes its time. Yeah.
But more than that, I'm sorry I don't have the words to describe it, but I do yoga nidra, and I go through and I try different teachers, and I'll say, oh, I don't like that one because I don't like the voice.
Right.
So.
And if that doesn't work for you, it's going to be really difficult to to create a trusting bond and relationship with that person.
But for me, it's sound is a very meaningful issue in my whole life. It's not just with meditation. So I don't know if I'm carrying over from one thing to the other. In any event, I'm sorry.
No. I think this is a good point. I was going to talk about it later. We'll do it right now. One of the things that clinicians who use hypnosis pay attention to, hopefully, are people's learning styles. You know, are you more visual? So you're probably much more auditory than you are visual or kinesthetic or tactile.
Well, that's actually changed over time. I find as I get older, I'm more visual.
And it does change over time. But you're still pretty auditory, right?
I'm aware of sound. I
Yes.
can put it that way. Yeah.
Yeah.
So I'm not someone to listen to talk radio.
Okay. Yeah, that's really important. And we when we're training people, they hear that from us all day long, or all week long. How important that is. And it's got a name actually. The name is prosody. It's that tone and the quality of the voice that changes when you use hypnosis. Okay, we talked about this. The old hypnosis literature talked about inductions, that we used to do a trance induction. And over the last couple of years, we've made a real effort to get away from that, because trance is something people have the ability to do and experience even without intending to. We go in and out of trance all day long again. So really, we're not inducing anything. We're not creating trance for them or to them. We're just helping them find ways that for them elicit what's already there innately within them. So what we do is work with people to find the easiest ways for them to use the trance state that they already experience day in and day out in different ways, in ways that are helpful for them. And that creates a transition from wakefulness to a state of trance. And we only would use as much as the patient needs. Some patients need a little longer time to get to the level of trance that they want to be. Some patients, it's a matter of seconds. I learned very early from my intern supervisor that, and that was a long time ago, that when, and Dr. Chalik, you'll recognize this, when patients walk into your office, they're already in trance. Sometimes it's a sympathetic trance that's disturbing and agitating and makes them restless. Sometimes it's a parasympathetic trance that allows them to be calm and comfortable. But if you're seeing a patient, when I go into the emergency room, into an exam room, that patient is already in trance. Their attention is focused, they're inner-absorbed, they're open to, they want things to change. All the things that define hypnotic trance, they are. So it becomes very easy to work with patients in medical and mental health settings, because they're almost always already in trance when we meet with them. So, yes, Mars.
I think sometimes, or at least years ago, it seemed to me, the word trance was something magical. It was something strange. And really, what you're saying is it's an everyday thing, but we don't always catch it or call it by its name.
Exactly right. It's an everyday thing that we all go through day in and day out, multiple times a day. Yes. And you're right. It used to be kind of a word that raised eyebrows and not any, and now it's made a nice transition to, oh yeah. And I think meditation and yoga and guided imagery have helped make that transition to a more normal state and a normal way of accepting it. So here are the physical signs. This is what changes physically when people are in a trance state, or when we're helping people enter a trance state using hypnosis. These are the things that happen. More calm, more comfortable. Their breathing, the depth of their breathing changes. It gets more shallow, easier, slower. Muscles relax sometimes. If you've ever been around young kids from like 3 to 10, you'll know that they're not very often relaxed. They are on the go continuously, but they're in trance. They're focused on something, they're inner-absorbed, they don't have no idea what's going on around them. They're a Power Ranger, they're something else in their imagination, not at all relaxed, but deeply in trance. We see muscle twitches, we see lacrimation. Lacrimation is that tearing or moistening of the eyes. That occurs very early in trance, as does eye fluttering and closure. Pulse rate changes, the jaw just kind of relaxes and drops. And catalepsy occurs, and we see some pallor, especially around the lips. And people are slow to respond when we ask them. And catalepsy is this immobility of a body part or the whole body. And I have always found it fascinating. I work with a lot of chronic pain patients. And when they come into the office, they'll sit down, and then in 2 minutes, they've got to go to a different chair. And they'll go from the straight back chair to the recliner, and then maybe they'll stand against the wall, and then maybe they'll sit on the floor, or maybe even lie on the floor, because they just can't get comfortable because of the chronic pain. But in trance, they sit in wherever they are and don't move at all except to breathe. The only movement you see is breathing, and maybe some REM movement under the eyelids for 20 minutes, which out of trance, it's impossible for them to do. So these are the physical signs of people being in trance. The psychological signs of people being in trance are just the ones we've already talked about. Absorption, focused attention, calm, comfortable. Time gets distorted, open to change, and very literal. The unconscious mind, which controls trance, is very literal. It takes things in a very concrete way. It's not like the front part of the brain, this prefrontal area where all the cognitive and analytic problem solving goes on. The unconscious really involves the more primitive brain, and it is very literal. And the important thing here is trance logic. Has anybody ever heard of trance logic? Trance logic is people's ability to, in trance, accept something completely that out of trance makes no sense at all. So it allows the absolute illogical to be logical. So those of you women who have gone through childbirth, tell me if this statement is logical. Remembering your childbirth experience, and with each growing contraction, you will feel yourself becoming more calm, more comfortable, more at ease. Does that make sense? In trance, that makes perfect sense. And you will then become more calm, more comfortable, more at ease. So we use it a lot for childbirth. We use it a lot for surgeries. We use it a lot for chronic pain because the unconscious will accept that as useful. There are a number of phenomena that occur with hypnotic trance. They occur involuntarily. They just happen in trance sometimes, or we can suggest them, and the person will accept the suggestion. It's just as if they happen by themselves. We don't do anything, they're just there. And they differ from the way we regularly interpret reality. And these phenomena are age regression. So in trance, very, very often people go back in time to when they were, to sometime in their childhood or their adolescence or 5 years ago or whatever. But people often will what's called age regress. And we can use that. We can suggest that you go back to a time prior to your surgery when you didn't have this pain, remember what that feeling felt like. And we can then transfer that in an age progression way. And now we can take that past the surgery. And when they come out of surgery, they're not in pain. Very helpful. Amnesia. Sometimes people will, the fellow who said, I don't think I was in trance because I heard every word you said, but he didn't hear the siren, and he didn't hear the phone, and he didn't hear the knock on the door, and he really didn't, his mind heard and his ear heard everything I said, but some of the things I said, he just didn't pay attention. He chose not to pay attention to. So he didn't hear them. He doesn't remember hearing them. And that happens. Spontaneous amnesias happen, but interestingly, they don't last very long. Things come back to people really quickly in a matter of minutes. Analgesia happens a lot. Analgesia is that reduction in sensation of pain or discomfort while allowing other sensations like temperature or where I am in the room or pressure to be experienced. So with analgesia, I can make this hand numb from the wrist down, completely numb, wooden numb, so that Dr. Chalik could put needles in it, he could suture it, he could do anything, and there would be no feeling at all in that hand.
I wouldn't do anything like that to you.
But you could. And there'll be no feeling in that hand. And the only thing that they might notice is some sensation, some mild pressure that if he just needed to change the position to do something differently, they will feel the movement, but not the nociceptive sensation of pain. That's pretty handy to be able to use. And then anesthesia, analgesia and anesthesia exist essentially on a continuum. Anesthesia is that development of total or almost total lack of any physical sensation in any part or all of the body. It's when we just what we say is we go to sleep. It's not really a sleep state, but when we have major surgery. And catalepsy. Catalepsy is that inability to move. So very often, and we use this in burn units a lot, where people have to have debridements and dressing changes. For example, if it's an arm or a shoulder, we can, in trance, I'll just lift this arm up and I'll very gently, this is just touching, it's not lifting at all. But it'll follow my hand, and then I'll put it over here on this shelf just to rest. And now that can just stay there as long as it needs to stay there. And the longer it stays there, the less a part of me it becomes. So this arm then just becomes dissociated and cataleptic. It won't move, and it won't tire because it's no longer a part of me that I experience. And I'm going to change that to this one so that we can see how that works. Dissociation is that feeling as if things around you just aren't really a part of you, that you don't have to pay attention to them. We can, sometimes we notice sensory alterations or changes in trance. Ever notice, I noticed it actually this afternoon again, and I thought I need to remember to mention this. I've been having I don't know what it is. I've been having some discomfort in my ankle recently, and as we started out to walk the dogs this afternoon, it really hurt. And then on the way back, half an hour later, I realized that we had gotten engaged in this ongoing discussion. And the whole time we were engaged in this discussion, I didn't notice my ankle. But as soon as I was aware of that, it hurt again. And that can happen spontaneously, or we can suggest that it happens in hypnosis. We talked about time distortion, and we talked about trance logic. And then after we've done our trance work, we want to just guide the person back out of trance, because essentially we're just a guide. The person already knows how to do this stuff. We're just a guide. So we want to bring them back to the previous, we want to bring them back to the level of alertness that they reported when we asked about it before we started doing hypnosis. Some suggestions we want to leave, like smoking cessation or absence of pain, but some we want to take away before we bring them out of trance, like not feeling anything in either leg and they have to drive home. Well, we want to take that one, we want to reverse that suggestion. And we want to ask them at the time that we're re-alerting them, we want to ask them again what their level of alertness is, because we want it to be equal to or greater than when we started, so that we know that they're fully alert and fully able to function. Dr. Chalik.
Yes, one of the rumors about hypnosis is, oh, well, you can make anybody do anything you want them to do. And maybe you'll say something about that, because I think.
Yeah, I would say you can make people comfortable doing anything they choose to do.
Better. Mm-hmm.
We can't make people do things they wouldn't normally do. But we can help them be more comfortable and find easier ways to do things that they do want to do.
Mm-hmm.
Make sense? Yes?
Absolutely.
Okay. Sometimes when we're re-alerting people, we'll go back to that louder, faster voice that kind of brings them back to the here and now. We'll involve other senses. Feel your feet on the floor, feel your back against the chair, that kind of thing. So we're just going to kind of bring them back in contact with their environment. And then we'll talk about what was that like? What did you experience? Did you experience anything differently than you did last time we did this? What did you find enjoyable or comforting or calming or interesting or helpful or useful? Is there anything that we should kind of remember for next time? Anything we would want to do differently next time? And what's your level of alertness now? So if we're looking at a hypnotic session from beginning to end, here's what it would look like. We would take some time to establish some kind of rapport or attunement, it's called now too, with our patient. We would talk with them about what hypnosis is and what it isn't. And I usually use those 4 things that we went through. Can you focus your attention on things? Yeah. Do you sometimes notice that you just kind of go inside yourself and you get real inner absorbed? Yeah. But good. That's 2 things out of the 4 that hypnosis is that you can do. Do you ever notice that time just sort of changes and gets away and gets distorted? What seemed like 2 hours was only 2 minutes, or what seemed like an hour and a half was 4. Does that ever happen to you? Yeah, it does. Good. Well, that's 3 of the 4 things. And when those 3 things occur concurrently, that allows people to be open to change and open to making things different in their lives. And when people see that that's all hypnosis is, those 4 steps used by somebody who's well trained to use them, they're perfectly willing to do that. I worked, any questions about that before I?
So a couple questions came in. I don't want to cut you off, but your hand's covering your face a little bit there. Sorry. Move it around. There were a couple questions that came in. Do you want to save them to the end, or some of them you've addressed, but
Go ahead. We can do either.
I'll do some of these. Someone wrote about how they're a retired journalist and they'd often sort of enter a zone when they're writing. Does that count as a form of trance?
That is trance. That is trance. Yes. Athletes are in trance almost all the time that they're performing. That's why they can get injured and not even notice it. They can do all sorts of things and not even be aware of them. But yes, as a journalist who's writing and just gets into it, it flows, and not aware of time and not aware of other things and not aware of the pain in my elbow or whatever it was. That's trance. And we would take we would take the person's memory of that and understanding, oh yeah, I do that all the time. And that's what we would use then to help them learn self-hypnosis, because our real goal is to teach all our patients self-hypnosis so they can do this for themselves anytime that they're in a safe place to do so for any reason.
Great. Can hypnosis be used to cure hoarding disorder or similar, something like that?
It can. I have a list here. I don't know if you all can see this. This is a list of medical conditions that we have literature to validate the positive use of hypnosis with these medical conditions. And they range from everything to allergies, to arthritis, to asthma, to back pain, to bleeding control, to burns, to cancer, diabetes, ego strengthening, headaches, hemorrhaging, hyperemesis gravidarum, that's the nausea and vomiting with pregnancy, hyperventilation, hypertension, migraines, nausea, obstetrics and high-risk pregnancies, pain, Raynaud's disease. We can warm hands with that. We can cool foreheads for migraines, sleep disorders, smoking. Those are the medical ones. These are the mental health ones that we have demonstrable evidence that hypnosis is effective. Anger, anxiety, anorexia, childhood fears, concentration, depression, ego strengthening, grief, loss, nail biting, hair pulling, obesity, obsessive compulsive disorders, performance anxiety, phobias, PTSD, self-hypnosis, sleep, smoking, stress management. So yes, we have lots and lots and lots of medical and mental health and dental conditions that we have literature that says that absolutely hypnosis works with this disorder. As long as you have a motivated patient who wants to change.
Thank you very much. I think you answered most of the other questions throughout, so I think good little break in the middle, but you can keep going.
Okay. All right. So here, if we were in an office, we might go through a list like this. We would do some rapport building. We would talk about what hypnosis is and what it isn't. We would ask about their level of alertness. We would help them get into trance. We would help them deepen or intensify that trance. We would do something to ratify that trance so that they know they're in trance. Then we would do whatever work we're going to do, prepare for surgery, do the procedure, talk about performance, how you can be better, all sorts of things. Whatever we're doing with them, we can do right there. We add a lot of ego strengthening suggestions. Then we would re-alert them and bring them, help them exit that trance. Then we would talk about it. What was it like? Get their post-trance level of alertness, and then repeat that. That looks like a lot. And sometimes in a psychologist's office where many psychologists still see patients for 50 minutes or an hour, you might do trance work or you might do hypnotic work for 30 or 40 of those minutes. It is equally effective. Trance work and hypnosis are equally effective going into an emergency department exam room saying, "Hi, Dr. Chalik. Dr. Jones asked me if I'd come in and see you before he comes back in here. He's just getting some things ready so he can come in here to help you feel a lot better. And he thought I might be able to show you some ways that you could make yourself even more calm and even more comfortable than you are right now. So that when he comes in to help you take care of this, you can barely even notice it. Would it be all right if we showed you some ways to do that, to be more calm and more comfortable? So that you don't even have to be bothered with him taking care of that arm." And I say that arm because now that arm dissociates from him. It's not, I didn't say your arm because he's still worried about that. I said that arm. So it's a different arm now that he doesn't have to worry about. So when we do hypnosis, language is really important, really, really critical. Because it helps us do these, it helps us facilitate trance, it helps us intensify or deepen trance. And it helps us with create this dissociation so that patients don't have to experience any more discomfort than they already were. Any other questions on the chat, Jonah?
There was one. Does the trance work when doing a telemedicine type appointment?
Yes, it does. In fact, we are still training people to do this virtually. We started back last June, did our virtual one. We weren't sure how it would go virtually, but aside from not doing a couple of things that involve touch, aside from that, we're able to train people to do everything else that they need to know how to do to use hypnosis to help people with trance and to help people with whatever it is they want help with. So yes, and most mental health people and still a lot of medical people are seeing patients virtually.
Yeah, there was a question on, it's a bit of a specific question on how does hypnosis work in reversing obesity or controlling overeating, something that obviously requires you to go beyond just that one session.
It does. It requires more than one session. Essentially, we teach them to recognize ways, to recognize cues in their lives that might cue eating or overeating or eating something they shouldn't, or might cue reaching for a cigarette. And we substitute a different cue so that the response then is a different response. Instead of reaching for a cigarette, they go for a walk, or whatever they choose to be different. But yes, it does work virtually. It has worked very successfully virtually. And in fact, now the Association of State and Provincial Psychology Boards, it's the association that governs, along with state boards, but helps govern and writes the examination questions and all that sort of thing. They've been working on it for about 5 years, but COVID hurried that up so that now psychologists and, well, psychologists for sure, medicine has in some cases had this already, but now psychologists will be able to do their work via telehealth with somebody in a different state. So if I'm working with somebody for 6 months or 2 months or 2 weeks, and they move to Colorado, and they want to continue what we were working on, we can do that now. It used to be you couldn't go across state lines to do that kind of work, but that's changed, and it's been very helpful and very popular.
Thank you. There's a couple questions on specifics that I'll save towards the end, but I think that was it's good to know that it works effectively virtually.
Indeed, it does. Okay, and we talked about a lot of the ways that this can help. We talked about, if there are no more media questions, let me just describe to you the levels. People, when we do trance work with people, sometimes they'll get very, very deep in trance. Sometimes their trance will be very light. Sometimes it'll be in between, and sometimes it'll change during the session. And the interesting thing is, in almost every case, it doesn't matter, because all that's required to do to work successfully with our patients, whether it's in mental health or medicine, even some procedures in medicine, all that's required is a light trance. And people can get through all that stuff medically or behavioral health issues easily in light trance. If I were taking, as a psychologist, if I was working with somebody who wanted to do an open abdominal surgery or a hip replacement using only hypnosis, then I would want him or her to be able to experience deeper trance, and I would work with them longer going up to that. In the emergency room, usually I see them one time, and we do a minute or two of hypnosis, and they're good to go. Because it truly does seem like magic. It's not. It's very real, but when you see it happen in less than 2 minutes, and people being sewn up and singing songs or talking to you or laughing about something else, it's pretty impressive. But to do a more major surgery, I would want to see that person multiple times before we did that. And of course, always, we would only do that with the consent of the patient, the surgeon, the anesthesiologist, who would also be there in case sometimes people slip out of trance or just end it on their own. So we would always want anesthesia to be there. And sometimes some surgeons and some anesthesiologists don't aren't comfortable with it, so we don't use it. I have a colleague who actually, we have a video of it. She had an open abdominal surgery because she almost died from anesthesia a few years before that. So she had an open abdominal surgery that occurred, and they repaired a big hernia that she had using only hypnosis for anesthesia and for pain. And she was talking to them the whole time, and she did a nice job with it. And I have a colleague who is at 72, this was about 2 years ago, had a total hip replacement using only hypnosis, and did really nicely with it. So it's useful for many, many things. Typically light or moderate trance is really all we need to use trance successfully. Light trance is that sense of kind of being physically relaxed, and breathing kind of slows down and pulse slows down. Still awake, but just kind of chilled, just kind of relaxed and calm and comfortable. Medium levels of trance are just a little deeper. It's more the awareness of things external to them goes away, so they become very internally focused, so that everything else around them just sort of fades into the woodwork, into the distance. So they're just very internally focused. They are much more receptive to sensory input, but they can choose to ignore it if it's not comfortable for them. And they can go through procedures and really easily at moderate levels. Deep levels, that's when you see catalepsies and no movement, and very, very deep. The focus is very internal. There's a lot of imagery going on, and their interpretation of things is very literal and very concrete, like it is in trance logic. And then there's another stage of plenary stage, but that's really not something we ever really even try to get to, because we don't need to. It's really this sense of you lose awareness of your body. Now, often patients will lose awareness of their body. So we always have to ask if, do you have, I always give them a suggestion near the end that says something like, and as you return back to this time and this place, bringing with you the same sense of calm and comfort that you've enjoyed this whole time now, allowing natural sensation and natural function to return to every part of the body as you just drift right up to this time and this place. Calm, comfortable, bringing with you anything that would be important for you to know for your own well-being and your own health. That's right. And we just give them that suggestion right at the end, and then so I think this was the fastest hour and a half I've ever had, an hour and 20 minutes. Questions, comments?
There's a couple other questions. If people want to unmute themselves and ask questions, they're welcome to as well. Someone asked, well, there's a couple logistical questions on how does one choose a good hypnotist if that's something they want to pursue, and does one, well, I think I know the answer to this one, but does one need a prescription for it? Probably not.
One does not need a prescription for it. Probably 95% or so of my referrals came from physicians and surgeons, because that's who I worked with. You don't need a prescription. At least I never ran into an insurance company that required one, or a referral. What you want to do is you want to not see somebody advertising in the paper that they'll be at the local Holiday Inn on Saturday helping people get rid of bad habits. Those often end up with problems down the road. What you want is somebody who is certified to use hypnosis. You also have to be very careful of that. There are some organizations who, if you just say, yeah, I've done this for 5 years, they'll certify you. Well, that's not what you want. You really need to investigate. The one organization that I know, because I chair the certification committee for the American Society of Clinical Hypnosis, or ASH. Dr. Chalik, I think you're a member of ASH. Is that?
Pardon? Remember who?
Are you a member of ASH, I think?
Yes.
Yeah.
And SCEH, yeah.
For us to be, there are 2 levels of certification for ASH. One is you have to have done 20 hours of introductory training, then you have to have done a minimum of 20 hours of intermediate level training in hypnosis, and do a lot of demonstrating to us while you're doing it. You have to complete an individual consultation of 60 hours with somebody at the next level of approval and have them sign off on it. You have to complete a teaching and consultation workshop that we give, and then you have to have used it with patients for 2 years. After all that, then you can become certified. If you want to go to the next level of certification, which is an approved consultant, you just add another 100 hours of training, add another 3 years of experience, and add another 20 hours of consultation. And then you can apply for certification. ASH is really pretty much the recognized hypnosis training and certifying body in the States. And really worldwide. I'm doing a workshop in a couple of weeks for Canada, one in Canada. We have people who go to Europe a lot to train people over there. So make sure they're legitimate. ASH is a legitimate one. There are the Ericksonian Institute in Arizona is a legitimate one. If you have a question about it, call about somebody's training or somebody's certification or somebody, feel free to email me or call me.
Great. We have hit, there's one more question I wanted to ask. We've hit 8:30, so I wanted to say thank you very much for taking the time to speak with us tonight on this Thursday evening, and thank you to Morris for arranging it. And if Morris wants to say anything before I ask this last question, you're welcome to, not to put you on the spot.
I do. I want to thank you, and immense thanks for lots and lots of information and help. You mentioned Milton Erickson. There was a story about him. I don't know if this still happens, but people did show business hypnosis who were not really hypnotherapists. And he attended something where he had several people on the stage. He ended his part of the show, and the others got off the stage, and one woman stayed on the stage, and Milton was in the audience, and the hypnotist couldn't get this woman off the stage. And Milton came up and he said, "May I try? Do you know this story?" He said, may I try? And he whispered in her ear, and she slowly got up and walked off the stage. And the, quote, hypnotist asked him afterwards, "What'd you do?" He said, "I said to her, you've been sitting here a long time. Your bladder is going to be full and you'll be very embarrassed."
Right.
And so
words are important, even words like that, and timing.
That's a great story.
It's a great story.
Thank you very much. And there's one last question about, is there a danger that a patient in a trance or under hypnosis might move as part of her body during surgery or do something while in that trance that could create a problem?
Well, I guess anything's possible, but it's not likely. If if we're taking somebody to surgery along with anesthesia, who will be there? It would depend on what body part we're working on. But we would, if they were working on this arm, I would help them dissociate this arm completely away from their body and have it be wooden and numb so that it wouldn't move. And then they could do the surgery on the arm, and then we could put the feeling back. That's one way. Another way is, we can still restrain a limb or a part of the body if we need to during surgery and still use hypnosis. If we think there's a possibility that somebody might move. So it's done both ways, and it really depends on how comfortable the person doing the hypnosis is, how confident they are, and it depends on the surgeon and the anesthesiologist. And I've always been very clear with me and with them. I'm in their operating suite. It's not mine. So what they say goes in there. I'll do what I can and what the patient wants me to do, as long as it's okay with them. That's the agreement we've always had with them. But yeah, we could immobilize it if we need to. We can immobilize it hypnotically. We could just have it put somewhere else.
Great, thank you very much. And thank you again for taking the time on this evening. And thank you to everyone for joining us for this program.
Thank you, Dr. Wagaman. Thank you.
Thank you all very much. This was an opportunity I've been looking forward to, and I hope.
And our best treatment.
Pretty fast.
Yeah.
Well, again, it's going pretty fast to get a lot in. I hope it